The topic of discussion now is developmental disturbances of tongue. So where we will be discussing the common developmental disturbances that can occur on the tongue. So what are all the basic developmental disturbances of tongue? So let's look into the classification of it. That is, it includes microglossia, macroglossia, ankyloglossia, cleft tongue, fissured tongue, median rhomboid glossitis, benign migratory glossitis, hairy tongue, lingual varices and lingual thyroid nodule. So here we will be discussing each and every developmental disturbance in detail. So first going on into microglossia. So this is basically an uncommon developmental condition which is characterized by an abnormally small tongue, that is a rudimentary small tongue, and there is a condition called as aglossia where is when the entire tongue is missing. And here is a picture where it is showing a small rudimentary tongue. So what are all the common consequences of having a smaller tongue? So actually tongue is a very powerful muscle which helps in the development of the alveolar arches. So whenever the tongue is very small, there will be lack of muscular stimulus between the alveolar arches, that is both maxillary as well as mandibular. So the arches will not develop transversely, resulting in severe dentoskeletal malocclusion. If you see the picture here, which is showing maxillary arch with a severe constriction as well as severe malocclusion, dental malocclusion too. And microglossia, it is associated with a syndrome called as oromandibular limb hypogenesis syndrome. Next, going on into the next condition called macroglossia, which is characterized by enlargement of the tongue or large tongue. So this macroglossia, it is seen in various other conditions, like the first one, basic one is Beckwith-Wiedemann syndrome. So here is an infant with the Beckwith-Wiedemann syndrome who is showing macroglossia, and along with that there are other features of Beckwith-Wiedemann syndrome, that is omphalocele, visceromegaly, gigantism and neonatal hypoglycemia. So along with this Beckwith-Wiedemann syndrome, there are other conditions like hypothyroidism. So if we see in Beckwith-Wiedemann as well as hypothyroidism, there will be diffuse smooth surface tongue, and in neofibromatosis and amyloidosis, here macroglossia will be there but with nodular tongue. So if you see here, this is a picture of amyloidosis which is showing macroglossia with nodular surface of the tongue. The next condition is lymphangioma, wherein even this situation shows macroglossia but with a pebbly surface on the tongue. And the next condition is Down syndrome, wherein we will see macroglossia with a papillary fissured surface of the tongue. So these are all the conditions wherein we can see macroglossia. But whenever there is a macroglossia, what are all the common clinical features a patient can see? That is difficulty in chewing or swallowing, drooling, slurred speech, widened interdental space, scalloping or crenations on the surface of the tongue, open bite or mandibular prognathism and secondary infection. So here if we see, this is a picture wherein a patient is showing a macroglossia with the crenations on the lateral border of the tongue. These crenations are nothing but they are marks of the teeth, interdental regions of the teeth. Next is ankyloglossia, which also means tongue tie, which is a developmental anomaly characterized by an abnormally short or anteriorly positioned lingual frenum. So lingual frenum will be very short. So ankyloglossia can be partial or total. Partial ankyloglossia is as a result of short lingual frenum or due to frenum which attaches too much near the tip of the tongue, like in this picture where the frenum is attached near the tip of the tongue. Whereas a total ankyloglossia where the tongue will be completely fused with the floor of the mouth. So what are all the problems which will occur when ankyloglossia is there? There will be speech problems as well as feeding difficulties in infants, and frenulectomy is the treatment procedure wherein the lingual frenum is cut to treat the ankyloglossia. Next is cleft tongue, which is also called as bifid tongue. So here is a picture of a patient showing bifid tongue or a cleft tongue. So how does this cleft tongue occurs? So if we see the normal development of anterior two-thirds of the tongue, it is formed by fusion of lateral two lingual swellings with tuberculum impar. So here there will be defective fusion or lack of merging of these two lateral lingual swellings, which results in this cleft tongue formation. Next condition is fissured tongue, wherein it is characterized by grooves that vary in depth and are present on the dorsal and lateral surface of the tongue. So this fissured tongue is also called as scrotal tongue or lingual pliccata. So here is a picture of fissured tongue wherein numerous grooves are there on the surface. So what are all the causes for fissured tongue? It is polygenic in nature, and sometimes aging as well as local environmental factors also can cause fissured tongue. This fissured tongue can be associated with the famous syndrome called as Melkerson-Rosenthal syndrome, wherein a triad of cheilitis granulomatosa, that is enlargement of the lips, and Bell's palsy, which is seventh nerve palsy, and fissured tongue can occur. So here is a picture of a patient showing Melkerson-Rosenthal syndrome, wherein there is cheilitis granulomatosa, that is enlargement of the lips you can see, as well as Bell's palsy, that is seventh nerve palsy also you can see. And other than Melkerson-Rosenthal syndrome, fissured tongue can also be associated with geographic tongue also. So this is a picture wherein the dorsal surface of the tongue is showing fissured tongue. Too many grooves are there, whereas on the lateral surface of the tongue you can see white serpiginous lines, which is nothing but geographic tongue. So next condition is median rhomboid glossitis, which is also called as central papillary atrophy or posterior lingual papillary atrophy. So this is a picture now which shows median rhomboid glossitis on the surface of the tongue. So usually, like we have seen earlier, the development of the tongue occurs by fusion of two lateral swellings and tuberculum impar. Here this point of fusion will be defective, resulting in a rhomboid shaped smooth erythematous area on the surface of the tongue, like in the picture. So this erythematous area is primarily due to the absence of filiform papillae. So sometimes this erythema, it is also associated with a variant of candidiasis called as atrophic candidiasis, and these lesions upon routine contact with the palate can even result in soft palate erythema also, like in this picture. Soft palate erythema is there. So these kind of lesions are called as kissing lesions. So as this is a candidal infection too, so it can be treated even with the antifungal agents. So next is benign migratory glossitis, which is also called as wandering rash or geographic tongue. So this is characterized by the changing pattern of a serpiginous white line with the surrounding areas of smooth depapillated mucosa. So this is a picture of a geographic tongue where you can see serpiginous white lines with surrounding erythematous area, which is a depapillated mucosa. So this geographic tongue, it can be associated with psoriasis. So it is also called as psoriasiform mucositis also. Other than psoriasis, whenever there is increased stress or fissured tongue, it can be seen. Geographic tongue can be seen. Histopathologically, if you see, wherein this is a stratified squamous epithelium with long, thin and elongated rete ridges you can see, with underlying thin connective tissue stroma. So if you see within the epithelium, you can see some small blue dots which are nothing but neutrophils. That means the whole epithelium is infiltrated with neutrophils, which is resulting in small microabscesses. So these microabscesses in these conditions are called as Monro's abscess. So these Monro's abscess, they are seen in geographic tongue as well as in case of psoriasis also we can see. Next condition is hairy tongue, which is also called as lingua villosa or lingua nigra. So hairy tongue, it is formed because of defective discommission of the filiform papillae. So this is a picture of a black hairy tongue. So how this defective discommission occurs is because of hypertrophy of filiform papillae, which is due to lack of mechanical stimulation. How does this lack of mechanical stimulation can occur? It can be by poor oral hygiene, which can be because of lack of toothbrushing or by eating a soft diet. Whenever there is no toothbrushing or eating soft diet, it will not mechanically debride the dorsal surface of the tongue. And this hairy tongue can be green, black, brown in color, and this color can be by excessive usage of tobacco, coffee or tea drinking, which can contribute to the color of the hairy tongue. So normal filiform papillae will be 1 mm in length, whereas in case of hairy tongue, the filiform papillae can go up to 15 mm. And usually asymptomatic, sometimes it can cause tickling sensation of the palate as well as gagging also. Sometimes it can be associated with candidiasis, where it is secondarily infected, resulting in burning tongue. So this hairy tongue has to be distinguished with hairy leukoplakia by immunostaining with Epstein-Barr virus. This is seen in case of HIV patients. Hairy leukoplakia is seen in HIV patients. So this is a histopathology of hairy tongue, wherein there is hypertrophy of filiform papillae, and adjacent you can see hyperkeratosis of the epithelium also. So this is about hairy tongue. Next we will look into lingual varices. So these lingual varices, so this is a picture of lingual varices, and what are they basically? They are dilated tortuous veins which are caused by increased hydrostatic pressure within them, but with a poorly supported connective tissue stroma. So these lingual varices, they appear as red or purple short like clusters of vessels, like in this picture, which are seen on the ventral and lateral surface of the tongue. There is no associated cause for lingual varices, but they can occur as a result of aging process only. Next and last condition, which is lingual thyroid nodule. So how does this lingual thyroid nodule forms first of all? So if you see during embryology, during 3rd to 4th week of intrauterine life, thyroid gland develops in the floor of the pharyngeal gut there. But by 7th week, this thyroid bud descends into the neck into its final resting position anterior to the trachea and larynx. The site where it descends later becomes foramen cecum. But if this primitive gland, it doesn't descend normally, it results in formation of ectopic thyroid tissue called as lingual thyroid. So what happens when lingual thyroid is present? So this is a picture of lingual thyroid, which is manifesting clinically as a nodular mass in or near the base of the tongue. So whenever thyroid nodule is present, what happens? It can result in dysphagia, dysphonia, dyspnea or fullness in the throat. But how do we diagnose that it is this thyroid? By thyroid scan, CT or MRI, which can be used to know the size and extension of the lesion. But biopsy has to be avoided in these cases for 2 reasons. That is, for any risk of hemorrhage can be there, or sometimes this can be the only functioning thyroid tissue for the patient. So when we do biopsy or when we remove it, we may end up in removing the only thyroid tissue in that patient. And histopathologically, if you see, this lingual thyroid nodule will resemble more like a normal thyroid tissue itself. So these are the common developmental disturbances of the tongue.